Okay, I'm going to talk about the benefits and risks of having an epidural. First of all, it is a decision that is entirely up to you, whether you want to get one or not. And it's something that you'll want to talk to your provider about before giving birth, so that way you can kind of have it in your birth plan, whether you're open to it or you just really don't want it at all. That's entirely up to you to decide. So just make sure you talk with your provider, and they might even have an anesthesiologist talk to you to kind of see if you have any other concerns or anything. So I'm just going to highlight some of the benefits and risks and go from there. So the benefits can be that it can allow you to rest. So if you're having a really long labor and you're getting really fatigued and irritated and just, I'm just kind of done and I want my baby to be born, then that might be a suggestion that the provider might give you, is to have an epidural just so that you can have that rest, and it will allow your body to just calm down and get through the remainder of labor. Also, sometimes if people are really anxious about having the baby, they can suggest you have an epidural. That way that your nerves just kind of calm themselves down and you're able to have a more peaceful atmosphere with your body, and then allow the labor to kind of do its thing in your body, and just give you that little bit of rest that you might need to get through the rest of it. They also might give it to you if you're going in for a C-section. You'll get an epidural that allows you to be awake and more alert, and they say that if you're not having a C-section, that can also be a benefit, is to keep your body kind of alert at what's going on with your birthing process. So some of the risks can be that epidurals can cause your blood pressure to suddenly drop, and that can cause some problems. So they'll be constantly monitoring your blood pressure with the cuff. You'll also have to lay on your side, and they'll kind of rotate you back and forth, which can slow labor for a little bit if you were standing or sitting upright because of gravity, obviously. So you'll have to stay there because the catheter will be put in through your back. So there are some women that experience pretty severe headaches after they get an epidural input. Some women will also experience some nausea and vomiting or tingling. Sometimes your ears ring. There's a lot of physical symptoms that happen. And if you know that you're a person that kind of doesn't do well with anesthesia, then that might be something you can talk to the anesthesiologist about beforehand, just so that you can kind of minimize those side effects if you still are wanting to get an epidural. There are also some researchers that say that if you have an epidural after you give birth, the baby can have a hard time latching for breastfeeding, just because they're getting affected by the epidural as well. So they might be a little more sleepy than normal. And then also the numbness can last for a couple hours after you've given birth. So that can be kind of frustrating to some women if you're wanting to get up and move around right away and you're not going to be able to do that. So that just highlights some of the risks and benefits. There are other ones, and you're welcome to talk to your provider about any further questions.